Coming up today, from life with a bad liver to life with a new liver, all thanks to one woman willing to give part of her own body to a total stranger. Good morning and welcome to the Morning Medical Update. I'm Jessica Lovell. Last year, we introduced you to Gary Gray. A rare autoimmune disease put him on the liver transplant waiting list. But after 2 years, time was running out. That's when a complete stranger saw Gary's story on social media and volunteered to donate part of her own liver. Today, we are checking back in with Gary 1 year after transplant. But before we get to that story, let's get to our COVID count from Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Doc Hawk, the inpatient numbers jumped to 33 last week. How are we looking this week?
Yeah, hi, thanks. Happy Monday. The numbers are looking a little bit better this week. We always want less compared to more. Right now, we have 26 active patients in the hospital, 4 of those in the ICU. So we've kind of gone down on our severe illness with COVID as well. So I think that's good, trending in the right direction. And we'll have to see how this next week goes, especially as we are getting into that specific Christmas holiday.
I want your thoughts on the urgent CDC's health advisory that went out last week to doctors and hospitals. It said that vaccine rates for COVID, flu, and RSV need to increase and that providers need to get shots in arms ASAP. So, Hawk, is this flu and virus season shaping up to be much different than years in the past?
Yeah, I mean, certainly when we look at some of the CDC data, and now I'm going to be referring specifically to the data that looks at the number of people who are reporting to an urgent care or primary care or emergency department for evaluation of respiratory illness. When we're looking at that, currently the trend in the peaking is not as high as it was last year, but it is certainly higher at this point in time than it was in the previous years before that, and even in 2019, 2020 respiratory viral season. So we could see an early peak, and it's always concerning because we don't know where that peak will be and when we will start to see a downtrend. So what that means basically is that there are the viruses circulating in the community at a pretty high extent. And so it is vitally important you still have time to get vaccinated. And yes, there is a large concern because those people most at risk, for severe disease and hospitalization, still have very low uptake of these vaccines, which we know can significantly reduce your risk of going to the hospital or going to the ICU. And there are programs available. So I know people a lot of times say, I don't know where to get the vaccine, or my physician's office is out of it. There is vaccines.gov, and you can go there and it can look. You can look up where you can get the seasonal vaccines in your community. And also, there's also access issues. We know that. So there is that bridge program that is going to be available to people who are uninsured to get those vaccines until December of 2024, so a year from now. So we'll provide more information about those, but certainly understanding where the vaccines are and access and cost are barriers to people, but there are programs and resources out there so you can find that information.
Yeah, thanks for sharing those today. Great info. Hawk, thanks so much. Well, the last time that we met Gary Gray on this program, liver failure was really impacting his ability to think and process. So before we see his remarkable turnaround this morning, let's look back at his pre-transplant story in today's edition of Where Are They Now?
Okay, let's go say hi, Fizz. If I set a goal for myself, it would be to live another 20 years.
63-year-old Gary Gray misses the simple things, like a long walk or hopping in the driver's seat.
It's real easy to become a hermit in a situation like this.
2 years ago, Gary was diagnosed with a blockage of his bile ducts, a condition that is destroying his liver. Doctors told Gary he'd need a liver transplant.
It was very, very shocking, and my wife and daughter have suffered through this too because they're worried about their dad.
While Gary waits on the transplant list, doctors monitor his MELD score, a number that determines where he ranks on the list of people waiting for for a liver. His MELD score must hover somewhere between sick enough to need a liver and healthy enough to receive it.
If you're getting sicker, waiting for a liver transplant, you have a higher risk of complications, more time in the hospital, more stress with dealing with the disease, and ultimately a higher risk of death.
Dr. Ryan Taylor is Gary's doctor and the medical director of liver transplant at the University of Kansas Health System. He explains the recent change to organ allocation.
In attempts to make things more fair, they took away those donor service areas, and they've developed a system called concentric circles, where they draw circles out from where the donor hospital is.
The impact on patients is huge.
By making these new circle model, they're trying to eliminate the disparities and try to share the organ access over a wider area than we had traditionally. So it's going to advantage some people who may not have access to the organs, but in areas where organs have been donated at a higher rate, those patients may be more disadvantaged now because the organs will leave those areas.
For Gary, some days are pretty scary.
Today, afraid. Some days we get a lot of good news, and other days finding out that our volunteer donor didn't make the cut was a real downer.
Gary sees a therapist regularly. He hopes to get back to the things he loves, the kids and grandkids, and his passion, music.
As Steve Martin would say, you can't be unhappy when you're playing the banjo.
Gary says waiting for a liver has changed how he looks at life. And what a difference a year can make. Gary and his wife Beth are joining us now. Gary, how are you feeling this morning?
I feel amazing, thank you.
Love it. Amazing. You can't get much better. Beth, how great is it to have your Gary back finally?
It's fantastic. It is a whole new world.
Well, we can't wait to hear how things have been going and to meet your donor this morning. Here in studio with us, we are joined by Gary's doctor, Ryan Taylor. Also, Dr. Clay King. He is a transplant surgeon here at the health system. Welcome, gentlemen, to both of you. Dr. Taylor, what was Gary's diagnosis, and just exactly why was it so crucial that he received a liver?
Yes, Gary had a disease called primary sclerosing cholangitis, and this is an autoimmune disease where your bile ducts get damaged and can scar your liver. The problem is that disease does not increase your blood work or lab tests that we use to share organs as much as other diseases. So at the end of the day, Gary was very sick from his disease, but his numbers didn't reflect his degree of illness.
So in short, he's going down on the list.
He wasn't at the top of the list to be able to have access to a transplant.
But he needed to be on the top of the list so he could live
how sick he was.
Yes, exactly. So, so Beth, what changes did you see in Gary while he was in liver failure?
His ability to process. Gary's a super intelligent, very humorous guy. His ability to process things and understand things and get his words out was drastically different. His ability to engage with people was different. His ability to enjoy life and his physical coordination were gone. And so he just wasn't, he wasn't the same Gary that we knew. We still loved him to death and everything, but we could see that he was kind of trapped inside there.
Well, and just from the months that I did that story with you all and came out to your home and met you both for the first time, and then by the time he came on the show the first time, I could definitely see the difference. Dr. Taylor, it was rapidly declining. So what went into play with what was he not? Did he not have time to wait for a deceased donor? Is that how that works?
He sure didn't. He was just getting weaker by the day. He was getting hospitalized more, having more serious infections. He was having more trouble with his thinking and his mobility, and just was getting to the point where he was almost going to be confined to bed because he was so weak.
So did you have to have that conversation like, hey guys, you might have to do the thing. You might have to go out and try to find your own living liver donor.
Yeah, I saw it's just hard to see a patient start to wither away in front of you, and we needed to look at all the options on the table to keep him going.
All right, Gary, Beth, when did you start the search for a living donor? Tell us the process.
Well, I remember reading in the day I was researching and realizing that patients like Gary don't succeed in getting a liver through deceased transplant because his MELD score was just never going up, and it was never going to. And then it was, my family and I were talking about that prospect, and his blood type is O, and none of us were O, and nobody in the family was. And then we had an appointment with Dr. Taylor after, and he brought it up, and we were both saying, I was saying, we were looking at it, he was saying, you have to, and it was like, okay, hit the ground running. And after that, our family and friends have just been so supportive, and we have some writers in the family, my sister-in-law and my sister put it together, and the village just kicked in, and that's where it went. We just feel so grateful that we have so many people who just ran with it and really wanted to do anything that they could. If they couldn't give a liver, they could pass it along.
Well, and you wrote out, as you mentioned, the writers in your story wrote out Gary's story and made a public plea. You put it out on Facebook, I believe. I call this kind of the positive power of social media. When good things come from social media, a complete stranger sees this story and steps up to the plate. Let's meet that stranger now. Lindsay Wilson, she is here with us this morning. You and Gary now know each other, but take us back to that first moment when you saw that post.
Oh, a friend of mine posted it, and are you guys getting good feed from me? Sorry.
We can hear you.
Okay. So I just saw it. I saw that he was needing O, and I have O blood type, and so it kind of just went from there. So there was never really a question. It was just like, oh, this is something I should look and see what I can do.
All right, Lindsay, that is not probably the reaction most people would have. They would see it, they would say, oh, that's too bad. This man needs a liver, and I hope he finds one, and maybe say a prayer. But you did the ultimate. You said there was no question, so you reached out to Gary and Beth. What was that conversation like?
I sent an email and just said, hey, like, I think it was something like, I have this blood type. I'm interested in knowing a little bit more. Are you still needing somebody? What do I need to do next was basically it, like, to find out more information.
So Gary and Beth, you put this plea out and then you get a response. Were you hopeful, or did you say, I know you had been through some disappointments before. What was that like when you read that email?
So I monitored that email.
Yeah.
Yeah, because go ahead.
No, I really thought it was a lost cause, to be honest with you, when we first started doing this. I mean, to find somebody with the right blood type, and then on top of that, find somebody willing to make this amazing sacrifice and have surgery performed on them that benefits them not at all, and benefits at the time a complete stranger. That's pretty miraculous that all the pieces came together the way they did. So yeah, when she responded, I was hopeful. I was very hopeful that it would all work out. There were still hurdles to overcome. I mean, as you can imagine, the evaluation process for patients like Lindsay is pretty thorough. I want to make sure they're doing it for the right reason, and that they're physically capable and mentally capable of handling it as well. So yeah, I was ecstatic and hopeful that it would work out the way it did.
And it did. So go ahead, Beth.
I just want to say on top of that, and this is where I think KU comes in too, is on top of that, because we had to travel across the country to do this, the person had to be willing to take a leave from their job, travel across the country with somebody else that could support them, that couldn't be from our family, and live across the country for up to a month. And so it's a huge ask. And I remember the first conversation Lindsay and I had, because, we had been through several other people who had been interested and for one reason or another couldn't. And she had such good questions and was obviously taking this very seriously, and I really appreciated that approach. So it wasn't one conversation, it was a series of conversations. And I think both of us are excited at the prospect of it being done locally to support Kansans who couldn't do what Lindsay did. She's just
Let's bring in Dr. King to talk more about that, because we would hate to think that you find somebody who's a match and then the proximity is an issue. And I would imagine that's a huge barrier. But that may change, as Beth alluded to, here for the folks in our region and right here at our health system. Tell us more and when.
Yeah, I think stories like Gary's and his recovery, just watching the videos. I mean, this is my first time really meeting him, and I know it's virtually, but these are stories that wouldn't happen without living donors. And we have other people in Gary's situation, and every transplant center has people like Gary that are unlikely to get a transplant before they get too sick to where then they can't get a transplant. And so at the University of Kansas, health systems here, we're trying to make sure we have all options available to patients so they don't have to go to the East Coast or travel, thousands of miles away and somehow find a donor that'll travel there with them, even if they don't know them. And so our job and what we really want to do is try to bring that to our health system, and so we can impact our patients positively.
And we do a lot of stories about organ donation, but the liver is tricky because you have two kidneys. You can give a kidney. A heart is going to come from a deceased donor. Talk about liver and the living donation part of it. How somebody's able to live with partial, how it grows in the other person. Kind of take us inside the body.
Yeah, I think I can speak to that a little bit with Dr. Taylor. The liver's an amazing organ, and depending on which transplant people you bring in here, somebody's going to say one organ's better than the other. The
Right.
liver is the most amazing organ, period. Although it's one organ, it really has 8 functioning separate units, and so the tricky part is being able to separate those units and continue to make the one that you leave behind function and the one that goes to the recipient function. And so the liver is essentially kind of like a tree. The donor, if they're a living donor, you got to leave the trunk of the tree behind. And so you're taking a piece that has smaller components, makes it a little bit more technically challenging, but the donor goes through a big workup. And basically there aren't really any anatomical questions left after that kind of workup. It's a lot of imaging, a couple different modalities. You really need to be able to give, on Gary's side, he needed an artery for the liver, he needed the portal vein for the liver. Those are the 2 inflow vessels. And then he needs a good hepatic vein so that the blood can flow freely out of the liver and not congest the liver. And then lastly, you need the bile duct to be able to drain the effluent from the organ that you're transplanting. And so you get all those from one half of the liver. Each of the sides has their own inflow and outflow. And then it's just, those are smaller components now because you don't have the whole liver. And so the technical aspects of the operation are slightly different, but all in all, you need inflow to the organ, outflow from the organ, and then you need to be able to drain whatever it is that organ makes. Whether it's a kidney, you need to drain the urine. For the liver, you need to drain bile.
Anything you want to add about your favorite organ?
Well, of course it's the liver, so there's no question.
Well, I want to talk about the recovery for all of this, and I want to bring Lindsay in first. Let's talk about the donor. What was it like to recover? What was the hardest part?
Honestly, taking the gallbladder was probably the worst part for me because I had a lot of referred pain, so a lot of shoulder pain, and they did an epidural before they put me under for surgery, and I kind of flinched with the epidural, and so I had a lot of lower back pain, but really that referred pain from removing the gallbladder was probably the worst pain that I experienced, and then also having to change my food, and that was more because of the gallbladder removal than it was really the liver. So that was probably the hardest part, and then because I'm a runner, trying to get back into running and just getting my course back was difficult.
You brought some photos. If we could pull those up, then you can kind of show us what you were mentioning, some of those scars and some of the visuals that we see afterwards.
That's my central line. So where all of and the doctors may be able to correct me if I'm wrong on this one, but that would be where they put most of my medication. It also went through that. Anything really that I needed was put in through my neck instead of through IVs. And then I did have an IV in my arm, and that's the bruise from the IV. I don't know exactly if that was during surgery or afterwards. So that's what that one is. And then that's just my incision. And there's a little bit lower down, there's where the bile drains, they put a little tube in, and so that while you're in the hospital, the bile is draining into this tube, and I don't know, kind of goes into this ball thing, and so then they have to empty it and measure it, and so there's a tiny little scar from that, but then my incision is pretty much almost gone. You can barely see it now. And that was...
Oh, go ahead.
Okay. Oh, no, that was in May. So that was still like, I guess that would be 5 months after surgery. And I ran, it was a 4 mile trail run. And when I got done, I really wish I would have done the 8 mile because I was feeling so good. I could have easily gone and done more. So I was kind of bummed that I didn't do the longer run.
Well, okay, that's pretty good. We'll take it though. That's fantastic. And I just, looking at those scars though, I mean, you're somebody you're fit, you take care of yourself. Forever, people are going to ask you what that scar is. So just tell us a little bit about that. I mean, it seems like you wear that scar very proudly to know that you gave to Gary.
Yeah, it's actually it's interesting because I went through this process where it really bothered me that I had it. And then I had somebody else who is a donor who showed me her scar, and she's like, I think 6 years post-surgery, and you can barely see it. And now my scar's fading, and it kind of bugs me that now it's not as obvious as it used to be.
Okay, that is a first. I have never heard somebody say that they wish their scar would leave a little bit more of a trail there. But Gary, what's that like to hear from Lindsay this morning, and just the bond that you two now have? I know it's pretty incredible.
Yeah, I mean, what do you say to someone that, essentially saved your life? And gave you another 10 years or 20 years to be with your family. What do I do? Send her a box of chocolates? I mean, I don't think I can really make up for that sacrifice. It's just, it still blows me away that it all happened the way that it happened.
Like, are you like family now?
Her mom is actually my daughter's stand-in grandmother. So yeah, we kind of linked up at the hospital, and we follow each other on Facebook and text occasionally to keep up with what's going on.
Unfortunately, we sort of neglect each other like family too sometimes when things get busy.
Well, then you just pick up where you left off. That's how it works. That's the good part about it.
That's right.
So yeah, I think we're I think we're at a point now where we're both. I was kind of waiting for Gary to feeling healthy enough, and I think now we're at a point where maybe we can try and get together and do a few things and get to know each other a little bit more.
That sounds like a good 2024 resolution. So does this mean that Gary's diagnosis is cured? Where does he stand health-wise? Once he's got the new liver, now what?
Gary's doing great overall. Everything is going really well at this point, so has a very great prognosis overall. His disease does have a chance of coming back, so we'll be monitoring him, but the odds are in his favor that he's going to do great with this transplant.
Be sure to ask your questions. You can use the chat on YouTube or Facebook. You can tweet us or email the Medical News Network. Information right there on your screen. Let's get to some questions from our viewers. Terry wants to know, why does liver failure cause mental changes? We look back at the way Gary is today versus when we interviewed him a year ago, and he was just having some cognitive issues. Do we know why that is?
Absolutely. So the liver, one of the functions of the liver is to clear toxins from the blood. And so when you have a sick liver, you're not able to clear those toxins very well. And so they can build up to levels and affect the brain. Many of the chemicals kind of act like sleeping pills, where they can make you drowsy, confused, and just basically not fire on all cylinders. And so the liver is doing so many things, but also keeping your body clean from toxins.
Chuck wants to know, once the liver regrows, can a donor do another donation? Or I think they've done enough. Doc King?
Yeah, I think the liver is unique in that it has regenerative capacity. The liver doesn't regenerate that. So if Lindsay gave her right lobe never grows back. The left lobe grows in compensation for what the right lobe now is gone. And so you have 8 functioning segments of the liver. She has 4, and that's what she's going to have, even though now if you got a CT scan of her, the layperson probably would just say, well, there's a liver up in the right upper quadrant. It looks like it fills the entire space. It does, but you would be able to find out pretty quickly, if you know liver anatomy, that she doesn't have a right portal vein, she doesn't have the right-sided component, so she has a left lobe. So there's really no way to donate any more than what she's already donated. I think she's done her job, and
she's done her
she's
deed.
done enough.
Quite the good deed, for sure. Yen wants to know, does a patient who undergoes a liver transplant need to take anti-rejection medications for the rest of their life?
Absolutely. You have to keep that liver healthy, and our own body's immune system has a tendency to try to push back and fight things that aren't recognized as self, and so that is going to be a lifelong commitment for anyone who gets a transplant.
Small price to pay. Reese wants to know, did Lindsay or Gary have to change their diets at all? Lindsay?
I did change my diet a little bit. It's just that, like cheese, things that are really rich, they just kind of go right through you. So kind of trying to, and I also quit drinking. It was, I think, for like a month before surgery. And then I think they had me not be able to drink. I think it was like for maybe 4 weeks after surgery. I can't remember if it was quite that long, but so not very much not very much change.
Gary, what about you? What changes did you make to your diet?
I haven't changed a thing.
Of course you haven't.
Not that I shouldn't have, but I didn't. and it seems to be taking out just fine.
Beth, do you harp on him a bit? Or you just let him do his thing?
It's never made a difference. So, but I do notice though that his tastes are different. He actually does eat better than he used to, and I think it's because the sickness was driving some bad habits, and now he's more active, and he does actually eat better than he used to. He also, Lindsay, volunteers more than he used to. I don't know if that's you, but he's gotten your volunteer spirit.
Yeah.
I bet he has. This has been quite a life change. I love that part of the story. And speaking of just diet and being fit, Jill has a question. You see that Lindsay's a marathon runner. I would imagine not all marathon runners are going to be donating. So how fit and healthy do you have to be to donate an organ like that?
The most fit part of the person has to be the liver. And so Dr. Taylor can speak to it. He sees people with fatty liver diseases that outwardly are not obese people. The liver has to be really inspected closely, and so we would like, if recipients bring donors forward, we can work through lifestyle changes and work to make sure that the liver's healthy enough. But part of the making sure that the recipient's going to do well is knowing that the donor's going to do well. And if you give half your liver and you don't have a healthy liver, then you may not do that well. And so the onus is really on us to make sure that we do a significant workup. And it's kind of like Gary spoke. They brought people forward, and not everybody's going to be an appropriate candidate for donation. And so having a marathon runner like Lindsay, that's a nice ace to have up your sleeve, that's for sure. And so runners and fit people are going to more often than not be a better candidate.
But don't let anything about your body deter you from bringing somebody to the table. As we wrap up today, I want to get our takeaways. Dr. King, what is the takeaway from our chat today?
I think it's that you can see success stories like this, and in the United States, in last year, about 600 of the 10,000 liver transplants were from living donors. And so we're going to have to increase that number in the United States, and we can only change what we can change. And we're here at the University of Kansas Health Systems. We're in the most generous portion of the United States with great patients and great potential recipients. And so we look forward to bringing that here.
Love it. Dr. Taylor, what's the takeaway?
It's really important to talk to your family about organ donation, whether it's going to impact such a story such as this, or just even in the event that there's an emergency and your life may, be at issue. And so it's good for family members to know your beliefs and that you want to help other people if that's something important to you.
But no better time than the holidays. Sit around the table,
have
bring
those
it up,
difficult conversations.
pass the potatoes, and talk about organ donation. I love that. Lindsay, what is the takeaway from your story?
It's so interesting when Gary talks about how much he's gotten from this, because I have equally gotten, I would say, just as much from him. I mean, I realize that he's, or from this process. So I think that understanding that by giving this gift, you aren't just giving something to someone else, but I've received a lot too.
Well, please be well. Keep running. Thank you so much for being with us today. Gary, what's the takeaway?
The only thing I wanted to say is this: I'm so excited that KU is moving forward on doing a liver or living donor transplant program, because it just opens up the opportunity for people like myself who might not have made it off of that list to get a solution. I mean, again, I don't know that I'd be sitting and talking to you today if we hadn't pursued the living donor. And I am here, so I'm thankful for that, but I'm happy to see KU is going to be doing that as well.
Well, we're thankful you're doing well, and you sound and look great. Beth, wrap us up. What's the takeaway from you and Gary's story?
Just keep doing the next thing. Don't give up. If you've got wherever there's an avenue, just keep pursuing it. Keep pursuing it. I don't know how many times we thought it was the end, and we kept reaching out, and Lindsay reached out, and you just got to keep trying. Hold on. When you've got crisis in your family, keep holding on and find people.
Thank you, Beth. Thank you to all of our guests today, and thanks to our viewers for being with us. We'll see you back here tomorrow at 8. Coming up tomorrow on the Morning Medical Update: gifts, guests, family, and food. There is a lot on our minds during the holidays, and sometimes we forget about that dry tree or dirty chimney. I'm Jessica Lovell on the next Morning Medical Update. Easy tips for holiday safety from the experts who see the consequences of a carefree Christmas.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcast. Now, everywhere podcasts are available.